I'm Sadegh Marzban from Math Oncology Department. We are in ASH 2024. In our project, we do a mechanistic learning, which is the merging of mechanistic modeling with the machine learning method that uncover the reciprocal cell-fate transitions that drive disease progression in B-cell acute lymphoblastic leukemia. In this project, we have the really nice data set from the flow cytometry from different states of CD34 and 38. I mean different states, we have CD34 positive, 38 negative, 34 positive, positive, negative, and negative. So we have 4 states. We hypothesize the transition between these states are important in BLL. So in order to calculate these transitions, we use a Markov chain model, math model, to estimate all these transitions. So we have 4 states, then we have 16 transitions. If you look at our data set, this is a nice demographic figure of our data set. We have the BCR-ABL1 status, disease status, and age of our patients. Every column is our patients, and every row is the features that we do have, MRD status, and some genetic features. In these 4 rows, we have the flow cytometry, and these red dots are showing how much expression of each flow cytometry in each patient. First result that we observed from our only data set, we observe high correlation of CD34 positive, 38 negative patients with the BCR-ABL1 positive. Also, we see a higher correlation of a patient with the flow cytometry of 34 negative and 38 positive with the remission patients. We also calculate, as I said, the transitions, these 16 transitions based on our math model. And we observe all the transitions going to stage number 1, which is 34 positive, 38 negative, clustered together, different from the rest of the transitions. From this result, we calculated the structural parameters here, which means the summation of all the status transitions going to stage number 1 as R sub 1 in, and the summation of all the transitions coming out of this stage as R sub 1 out. In these 2 figures, we can compare the 2 examples from one example BCR-ABL1 positive, the other negative BCR-ABL1 patient. In this patient, we see the high number of R1 in, which is the gray color, and in this patient, we see the high number of R sub 1 out, which is the purple, dark purple color. So we have again 4 states, then we have 8 structural parameters. Based on these 8 structural parameters, which is the summation of going into this stage or coming out of this stage, we do a machine learning and we observe these 2 R1 in and R1 out are the most informative one. And we see these transitions, this really nice chord diagram. See, we have this chord diagram for the BCR-ABL1 positive, which is very differentiable from this chord diagram for the remission patients. Very high R1 in, very high R1 out. We observe this result here as well. We see the highest number of R1 in for the patients with the BCR-ABL1 positive and the highest number of R1 out for the patients in the remission status. Also, we observe this phenomenon for the MRD status, which is the minimal residual disease, for higher number for the MRD positive, for R1 in, and higher number for R1 out for the remission patients. Then, in order to see how much accuracy these structural parameters can provide for us, we use the machine learning method, and we were able to predict the BCR status, BCR-ABL1 status of the patients using these 2 structural parameters with the 84% accuracy. Also, we were able to predict the MRD status with 70% accuracy based on only these 2 structural parameters 6 weeks ahead of the time. So we use a mechanistic learning to find the most interpretable and accurate features based on our clinical features. Thank you so much.